Cobran, and the topic that I have for this week's discussion board is what I would like to change about today's healthcare system. And that answer is it would absolutely have to be federally mandated staffing ratios. High nurse to patient ratios are a huge contributing factor to the issues of nursing burnout and staff turnover. I used to work in corrections nursing, and sometimes the ratio was over 40 patients to one RN. There was no LPN. There was no other RN to help you. There was no tech to help you, at least not if you work night shift like I did. And people were constantly quitting that job. And appropriate staffing can prevent the issue of people constantly quitting, and then you have to orient and retrain and replace them. Huddleston and appropriate staffing can prevent this. Huddleston and Gray defined appropriate staffing as having enough staff on hand to provide patient care that is safe, efficient, timely, and patient-centered. The care must also be tailored according to patient acuity, the skill level of the staff assigned to the unit, and any staffing matrices that are used by the healthcare organization itself. I believe that lobbying for federally mandated staffing ratios is both legally and ethically the right thing to do. Nurses who feel like they have to keep rushing from task to task because they're overwhelmed that there's not enough staff, these nurses are more likely to take shortcuts and make mistakes. This in turn will leave the healthcare organization vulnerable to malpractice lawsuits. And understaffing also violates the ethical principle of beneficence, which is defined by Sullivan as the duty to help others to do by doing what is best for them. And it's not the best for the patients to have nurses who are so overwhelmed by their to-do lists and the call lights because there are too many patients and not enough staff. Patients will likely have better outcomes if the health care organization is properly staffed, and this is especially true in term care settings, where tasks such as feeding patients and bathing them and performing incontinence care can be very, very time consuming. Nurses may end up having to do these things themselves because there may only be one aide for a hall with 20 patients. And obviously the aide won't be able to help the nurses if they're in another room providing care for another patient. Nurses are being held increasingly responsible for patient outcomes and quality because they're the staff members who spend the most time with the patients. And I believe my current employer has effective team-based nursing in place. At the psychiatric facility where I work, every nurse and every tech is responsible for providing care for all the patients on the unit instead of being assigned to a certain block of rooms or a certain hallway. However, our organization desperately needs to restructure its staffing matrices. My unit is often short of tech, which means that there's no one on the floor to provide patient care because all the other techs are sitting on close with patients who need one-to-one supervision or doing the mandatory 15-minute safety checks. And so then nurses must answer the call lights and toilet patients. And in between this, we're trying to pass medications and provide wound care and other treatments for up to 28 geriatric psychiatric patients and psychiatric patients who are medically fragile. The effectiveness of better staffing can be evaluated by comparing pre and post intervention fall rates, occurrences of medication errors, and the time that it takes between when a patient rings the call light and when a staff member is able to provide them with care.